Most of us spend a lot of time staring at our screens. So how is it affecting our eyes? Dr. Chebil is here to talk to us about digital eye strain. I'm Anita, and this is Care Experts. Today we're talking about digital eye strain with Dr. Alexandra Chebil, a Harvard-trained board-certified ophthalmologist with the LASIK Center Medical Group. Thank you so much for joining us, Doctor.
Thank you for having me, Anita.
So I'm very interested in this topic we're about to talk about, which is digital eye strain. So I know so many of us spend so much time staring at our phones and screens. So tell me, what exactly is digital eye strain?
As you focus on the computer or even on your cell phone, you don't blink as much and your eyes get dry, they get irritated, you can get a headache, you can have neck ache and backache, and it's all related to the blue light in the computer, the lighting, the glare. All of these can cause your eyes to be strained when you're doing a lot of digital work.
So what exactly is it that causes the digital eye strain? I know you mentioned the blue light, so is it that specifically?
It's blue light and the fact that when you're looking at a digital screen, even in children, you don't blink as much. So the natural reflex when you're looking at something is to blink. But when you're staring at a screen, you don't blink. And it's becoming a real epidemic, digital eye strain, even in children.
I can imagine, because we're all glued to some kind of screen all the time. Now, how long does this digital eye strain usually last?
It lasts as you're using the computer. It's not a permanent thing when you walk away from the computer, but it's important to address it, to put yourself in the good working conditions so that you don't get eye strain and digital eye strain from the start.
Can this cause a permanent condition?
It doesn't cause any permanent condition. No, absolutely not. It's just the short-term discomfort and eye strain.
So what are some things that people can do to maybe help them not get this digital eye strain?
First of all, you have to put yourself in a good working condition. You have to eliminate glare. Glare is a big problem causing the digital eye strain. So if possible, try to reduce the brightness on your screen. Get rid of the ambient lighting that can be a distraction, sun coming in, bright white walls, if you can reduce the brightness of the walls if you're in your own home or your workplace. Also, fluorescent lighting can be a factor. If you can turn down any kind of artificial lighting, reduce that. Maybe have a desk lamp that's giving you more natural lighting. So getting rid of the glare, putting yourself in good working conditions, meaning keep your feet on the floor so that you're stable as you're using your screen. If possible, adjust the distance that you sit away from your computer screen. Ideally, it's 20 to 24 inches. And if you can get the appropriate angle that you're looking at the words that you're reading. So if you're looking at, don't look at something straight ahead. Ideally, it's 10 to 15 degrees below the horizontal. That would be the ideal angle to do your computer work.
Interesting, because my next question was going to be, is there a recommended distance that you should sit from a computer? And I think you mentioned
20 to 24.
Okay, so that's definitely going to help with you having a better view when you're reading.
Of course, yes. And then the other thing you can do is to get a good computer monitor. The older ones, which were the cathode rays, they gave off a lot of blue light and the flicker factor. So when you're looking at a screen, if you're looking at for example, fluorescent tubing, there's a flicker in the light that you might not be aware of consciously, but it does affect the quality of what you're looking at. So get a good flat screen monitor. Appropriate size, 18-inch diagonal is kind of a minimum that I would recommend. And adjust the contrast if you can so that the font is the right size for you, and also that it is, black on white. You'll see it a lot better than the colored or the gray font.
I've noticed, for me personally, if I have my brightness on my phone up too much, I can feel my eyes getting strained.
Exactly.
So it's interesting you said that, to bring the fluorescent, the light down on your phone.
And if you can try to make the lighting as natural as possible, because that does eliminate a lot of the blue light. The short wavelength, the blue light, is a lot more harmful to your eyes than the natural lighting with the orange and red. So if you can try to eliminate that, or maybe put a filter on your monitor.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on digital eye strain. Now, how would you treat digital eye strain medically?
The only thing you can do is to prevent it. It's not a
Okay.
condition that's going to cause a permanent problem.
Okay.
But if you address it with the adjusting your computer, getting a good screen, adjusting the glare, and also you have to rest your eyes every now and then. That's the most important thing when you're working.
Yeah.
Sometimes you can't get rid of the glare and you can't get a new monitor.
Yeah.
So we call it the 20-20-20 rule. Every 20 minutes, you should look up for 20 seconds at a object that's at least 20 feet away. So not just keeping your eyes focused on the same
Right.
spot. You look up every now and then, relax your eyes, and that relaxes the muscles and should helpfully reduce the eye strain. And also blinking.
Yeah.
Get in the habit of blinking.
Well, it sounds like you're saying medically it's beneficial for us to disconnect with our screens a little bit more and
absolutely.
stop looking at our phones and the computer.
Look up every now and then and see the world.
Yeah. And I'm curious, how effective are blue light glasses and these screens that you can use at filtering out the blue lights? Do you think that's something you would recommend that maybe patients that feel digital eye strain could get?
It's certainly worth a try. You're getting rid of the blue light, which is the most harmful, that can also cause cataracts. So put it over your screen, give it a try. It doesn't work for everybody, but can certainly help.
Now, you mentioned earlier that blue lights could cause cataracts. So explain that a little bit more.
Well, there's short-wave light, like blue light, ultraviolet light, penetrates the surface of the eye, goes through the lens, and that can promote the development of cataract long-term. That's why it's good to have a blue filter on your screen, and also to always wear the ultraviolet protective sunglasses when you're outside.
Yeah, wow. It sounds like there's a lot of small things like that that we can do to prevent these things that could happen down the line.
Yes, yeah, all about maintenance.
Yeah. And what exactly is cataracts?
There's a natural tissue in your eye called the lens,
Okay.
and it's one of the main focusing powers in your eye that helps you to see up close in particular. And over time, the ultraviolet light goes through the eye over years and years. So it's like, kind of like you leave something out in the sun for 50, 60 years. It's going to change color. It's going to change into a yellow shade. And that's what happens when a cataract develops. So when you're looking at something, all the light coming into your eye has to go through that yellowish tissue. And the more opaque it becomes, the darker it becomes over time, the worse your vision is. And it does have to be eventually removed when they get to that stage.
So that makes sense why all, the blue lights, the ultraviolet lights can be so harmful on your eyes over
Exactly,
age.
exactly.
Yeah.
The lens is meant to protect the back of your eye from the ultraviolet light, so it's absorbed by the lens, and that's why the lens changes color.
Well, thank you so much for talking to us about digital eye strain. I know it's something that every single person today is probably experiencing at some point, right?
Exactly. Even your kids.
Yeah. Well, so we have a few rapid fire questions called myth or fact that I want to go
Okay,
through with you right
exciting.
now.
Go ahead.
So you can tell me if it's a myth or a fact. So myth or fact, our phones aren't as harmful on our eyes as our computers.
That is a myth. The phone is just as harmful. It's the same blue light. It's the same glare, exactly the same. It's a screen's a screen.
Yeah, I think we would like to tell ourselves that so you don't feel as guilty staring at your
Oh,
phone.
no, this is bad. Sorry.
Yeah. So myth or fact, there's nothing we can do to prevent digital eye strain.
That is a myth. Absolutely. We went through the steps, the 20-20-20 rule, the screen, the quality of the screen, resting your eyes, blinking. There are all different options out there.
So myth or fact, digital eye strain does not affect people that wear blue light glasses.
That is also a myth. You can reduce the digital eye strain with the blue glasses, but it doesn't cut out the other factors like the blink factor and the glare and all that.
Well, thank you, Dr. Chebil. You've been so informative on digital eye strain.
You're very
which
welcome.
I know it's
Yay.
something that every single person today is experiencing, so it's great to just hear about things that we can do that are so simple to alleviate that.
Yeah, take charge.
Yeah, thank you.
You're welcome.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.